Conception, the union of a male sperm cell and the female egg cell to form a new organism. The prenatal development has three stages of development. It is germinal, embryonic, and fetal.
Germinal period. It happens 2 weeks after conception. Includes creation of the zygote, continued cell division, and the attachment of the zygote to the uterine wall. Rapid cell division, and by the end of the stage, the fertilized egg becomes a blastocyst and plants itself in the wall of the uterus. This is the picture of fertilized egg or zygote in day 1 to day 9. It is 24 to 30 hours after fertilization, 36 hours after fertilization, 48 hours or 2 days after fertilization, 72 hours or 3 days after fertilization, 96 hours or 4 days after fertilization, and the 4 to 5 days is the blastocyst, 6 to 7 days, and last is 11 to 15 days.
The embryonic period happens in 2 to 8 weeks after the conception. The zygotes become embryo, cell differentiation interface, large support system from the embryo develop, and organs appear. In the first month or 4 weeks, here's the picture of the embryo or the unfiltered egg. And at the end of the 4th week, embryo is 1/4 inches in length. Heart, digestive system, backbone, and spinal cord begin to form, and the placenta begins to developing too. In the fertilized egg is now 10 million times larger than before. And this is the picture of 6th week, 7th week, and 8th week. At the end of the 8th week, embryo is 1 1/8 inches in length. The nose, eyes, tongue, lips, ears, and teeth, or the external part of the body of the baby, was forming, and also the heart of the baby was functioning too. And the organogenesis, the process of organ formation during the first 2 months of prenatal development. And this is the 3 layers from endoderm, ectoderm, mesoderm, and the support system for the embryo development is rapidly, which are the placenta, umbilical cord, and this is the picture of the placenta, the umbilical cord, and the amnion. And also this is the part of the tummy of the mother, or yung placement of the baby inside the tummy of the mother.
Fetal period or 9 to birth. The fetal stage is marked by the development of the first bone cells. The embryo is now called the fetus. By the 3rd month, the fetus is able to move its head, legs, and feet. By the 4th month, the mother may feel quickening or fetal movement. The beginning of 7 months is considered the age of viability. At the end of 9 months, the fetus weighs an average 7.5 pounds and is almost 20 inches long. 2 to 7 months after conception, growth and development continue dramatically during this period. 3 months after conception, fetus is about 3 inches long. It has become more active by moving its arms and legs, open and closes its mouth, and move its head. The genitals can now be identified as male or female. 4th month or 16 weeks. Fetus is about 6 inches long. Stronger prenatal reflexes, first arm and feet movements are felt by the mother. By now, the fetus has grown large enough that the movements can sometimes be felt by the mother, often felt like a flutter or a flip-flop. These first movements that can be felt by the mother are called quickening. At the end of the 4th month, white downy hair called lanugo covers the entire body of the fetus. It provides warmth since the fetus has no layer of fat beneath the skin yet. At some point later, a white waxy cheese-like substance also forms over the entire surface of the skin, and this is called vernix caseosa. The vernix is a perfect skin lotion which, along with the lanugo, protects your skin from the constant exposure of amniotic fluid. It is also believed that it is served as a sort of skin cleanser and antibacterial substance. Fifth month or 20 weeks. Fetus is about 12 inches long. Structures of the skin have formed. Fetus is more active. During the 5th month at 22 weeks, the fetus weighs a little over 1 pound and is about 1 foot in length. At this time, the movements can clearly be felt by the mother and by others who place their hands over the mother's abdomen. The fetus also shows a sensitivity to light and can be stimulated and irritated. However, it still has a long way to go before it is mature enough to survive outside of the womb. 6 months or 24 weeks. Fetus is about 4 inches long. Eyes and eyelids are completely formed. Fine layer of hair covers the head. Grasping reflex present and irregular movements occur. During the 4 to 6 months, most of the organs that were formed during the first trimester begin to function. If born at this time, the fetus has a chance to survive. The point in which it can first survive is referred to as the age of being viable and occurs sometimes between 22 and 26 weeks. 7 to 8 months. Fetus is 6 inches long. Organs are maturing. The skin is still wrinkled and red. If born at this time, he or she will be considered a premature baby and required special care. By the 8th month, the fetus has little room for large movements. During this month, a layer of fat is added that will assist with temperature regulation. The lungs, however, still remain immature. If born at this time, the infant will likely require some help with breathing. It is usually not until the 9th month and that the lungs are mature enough to regulate breathing without assistance. 9 months or 38 weeks. Fetus is 19 to 20 inches long. The lungs are mature. Baby is now fully developed and can survive outside the mother's body. Skin is pink and smooth. He or she settles down lower in the abdomen in preparation for birth and may seem less active. During this last month of the gestation period, baby continues to grow. At a rate of 1/2 to 1 pound per week, baby will turn around in the womb to a head-down position. The lungs are maturing, preparing for that first breath. This is the end of the 3rd trimester when the main task was growth.